The next communicable disease is malaria. Malaria is a parasitic disease. It is caused by Plasmodium and it is transmitted to man by the bite of infected Anopheles mosquito. So, this is a picture of a malaria patient. Definition of malaria: it is a protozoal disease which is caused by Plasmodium and transmitted to man by the bite of female Anopheles mosquito. And malaria is seasonal. In India, it is commonly seen from July to November. Then this all of us are aware malaria is transmitted by the bite of Anopheles mosquito, and a single infected mosquito during the lifetime can infect several people. The mosquito is not infective unless sporozoites are present in the salivary glands. Next is etiology of malaria. There are four different species of malaria parasite: Plasmodium vivax, Plasmodium falciparum, Plasmodium malariae and Plasmodium ovale. Plasmodium vivax has the widest geographic distribution throughout the world. Commonly, Plasmodium vivax is seen. Then it is very common among young children. And how malaria happens? It is because of the bite of the female Anopheles mosquito, especially at the night time. And if the mosquito bites a person who is already infected with malaria, then it becomes infected and it can spread the parasite to other people. So that is how the mosquito gets infected with the parasite. Okay, the mosquito will bite the person who is having the infection, and then the mosquito will be a source of carrier. Okay, malaria cannot be spread directly from one person to another. Only through the bite of mosquito it can spread. Then it is also a risk factor for pregnant women to get malaria. If they get malaria, there is high risk of usually miscarriage or intrauterine death. Sometimes it can result in premature labor. Sometimes it can lead to low birth weight babies or maternal death. Next risk factor is people with the HIV AIDS. Next is international travelers, especially who are traveling from non-endemic areas because of the lack of immunity. If they are having no immunity, if they travel to endemic places where there is malaria, then it can cause malaria. Next is housing. Now, housing will play an important role in the epidemiology of malaria, mainly because of overcrowding places, or if the housing is not having good ventilation, if there is no good lighting facilities, that can be like a source of breeding for mosquitoes. So that can cause malaria. Next is malaria is commonly seen in rural areas, or even we can tell in poor, undeserved, marginalized population where the control of mosquitoes is not there. Okay, and it is seen that malaria is more commonly seen or more prevalent in tribal groups, especially in the remote areas. Next is occupation wise, it is also seen that in the agricultural region, this malaria breeding is more common, especially in the farm lands and all. So that is why in rural areas again malaria is very common. Next is human habits like sleeping outside or nomadism, that is roaming everywhere. Okay, or refusal to spray the houses or replastering the walls, and usually not using the nets, okay, mosquito nets. That also is one of the major causes for the spread of the mosquitoes. Okay, then it is seen that in the rainy season this spread of mosquito or breeding of mosquitoes is very high. Okay, rain will increase the atmospheric humidity, and again the survival of mosquitoes is more, especially in the irrigation channels, in the burrow pits, garden pools, or construction sites, roads, dams and all, more and more breeding of mosquitoes will be present. Next is moving on to the clinical manifestations of malaria. Most of the time, a person with malaria will be having fever, they can have headache, then along with fever, they can have chills, then most of the time they will be having sweating once the episode of fever is over. Okay, that is excessive sweating or perspiration, excessive body weakness, body pain will be seen. Then they can have sometimes enlarged spleen, which is called as splenomegaly. They can have mild jaundice. Enlarged liver is also seen, that is called as hepatomegaly. Along with that, increased respiratory rate. Then body pain is also very common, and some patients will usually complain of nausea and vomiting. Next is stages of malaria. The stages of malaria is divided into three stages. First one is cold stage, then hot stage, then next one is sweating stage. So first of all, moving on to the first stage, that is called as the cold stage. So in the cold stage, here the temperature will be rising from 39 to 41 degrees Celsius, and along with that the patient will be having headache. The patient will have nausea and vomiting also, and in this early stage the skin will be very cold initially, later it will become hot. Okay, so next what happens is the pulse is usually very rapid, and parasites, that is this protozoa will be usually seen in the blood. Okay, and this stage will usually last for usually 1 hour. That is called as a cold stage. Next stage is hot stage. In hot stage, the patient will be feeling very hot after the cold stage. So they will feel hot and they will feel like removing the clothes. The skin will be very hot to touch, it will be very dry, and headache also will be very intense. Usually the patient will have severe headache, and nausea can usually reduce. The pulse will be very rapid, and this hot stage is present for around 2 to 6 hours. Next is sweating stage. So after the hot stage, the patient will profusely sweat. Perspiration will be very high, and then what happens is once the temperature drops, the skin will become cool and moist, and pulse rate will slowly become very slow, and this stage will be lasting for 2 to 4 hours. After this stage, usually they will fall asleep. The patient may fall asleep. Next is complications of malaria. So most of the time, malaria can result in hemolytic anemia. It can cause kidney failure, liver failure, respiratory failure, meningitis. Then it can also result in internal bleeding. Most of the time, the complications of Plasmodium falciparum will include the complications of Plasmodium falciparum will include cerebral malaria, then they can have renal failure, liver damage, then gastrointestinal symptoms are very common, dehydration, they can have shock and anemia. And most of the time, the patient can also have severe complications because of this Plasmodium falciparum. Next is complications of Plasmodium vivax. In case of complications of Plasmodium vivax, or in case of complications of Plasmodium ovale and malariae, patient can have anemia, that is decreased hemoglobin in the blood, splenomegaly, that is enlarged spleen, hepatomegaly, that is enlarged liver. They can also develop with renal complications. Then these are some other severe complications of malaria. Like they can have altered level of consciousness. Most of the time when they get mixed malaria and all, sometimes the patient can develop with altered consciousness. They can have drowsiness or they can go into a stage of coma. Cerebral malaria I have already discussed. Usually here patient may be with this falciparum, okay, and they will not be aroused, they cannot be aroused, or they may go into a stage of coma, that is called as cerebral malaria. Along with that, sometimes patient can develop respiratory distress or respiratory failure. Some patients can develop with convulsions or seizures. Okay, they can have shock or hypotension. It can result in septicemia or sepsis, and patient can have pulmonary edema. They can have abnormal bleeding and DIC, that is called as disseminated intravascular coagulopathy, where there will be excess of bleeding in the patient. Some patients can also have yellowish discoloration of the skin, which is called as jaundice. Some patients can have hemoglobinuria, which is called as black water fever. In this hemoglobinuria, the urine will be usually having this excess of free hemoglobin. Because of that, the urine will appear blackish in appearance. Then patients, most of the time, if they don't take adequate fluid, can go into renal failure, okay, where they can have oliguria or anuria. Severe anemia is seen because of the excess breakdown of hemoglobin. They can have fever. Sometimes patient can have excess of hypoglycemia, where the blood sugars will be usually reduced. So those are the complications. Diagnosis of malaria will include physical examination can be performed. You can perform blood investigations, then microscopy can be performed, complete blood count can be taken, and even polymerase chain reaction can be performed. Most of the time smears are taken, that is thin and thick smears will be usually taken in order to detect this malaria. Next is moving on to the treatment of malaria. Now, this WHO recommends that usually this monotherapy means single drug is not effective, especially in endemic countries. So better to give combination therapy means it is recommended to take 2 or 3 drugs together. Okay, now first we will see the treatment of Plasmodium falciparum. So in case of treatment of Plasmodium falciparum, they are recommending these drugs. Okay, that is artemether as well as lumefantrine together has to be given. Next is artesunate as well as amodiaquine. Next is artesunate as well as mefloquine. Next drug therapy is artesunate and sulfadoxine, which is referred as pyrimethamine. Okay, so that combination of drugs is recommended by the WHO. Second line of anti-malarial drugs are, it is recommended to give artesunate along with tetracycline or doxycycline and clindamycin. Usually this drug therapy is given for 7 days after they are taking chloroquine. Okay. Next is treatment of Plasmodium vivax or oval infection. In case of treatment of vivax, you can give chloroquine tablets or you can give primaquine. Okay, so that is usually recommended for the patient. And always see that do not start the treatment in the empty stomach, and when you are giving the first dose, always keep the patient under observation. Okay, and see that if the patient is having vomiting, again you may have to repeat the dosage. Okay, so this is not necessary. Next is some other drugs. Other drugs are including quinine, artesunate, artemether, clindamycin and doxycycline. Along with that, it is very essential to control the breeding of the mosquitoes. So to control the breeding of the mosquitoes, advise the patient to use mosquito nets. Okay, so other than using of mosquito nets, other than using the mosquito nets, you have to, you can also ask the patient to use in order to use this long sleeve clothes, etc., in order to protect the body from the bite of mosquitoes. Then ask the patient to close the windows, especially at the evenings. And then controlling the breeding of mosquitoes can be done most of the time by preventing the breeding of mosquitoes in the pools or in the sewage pits and all. Then next is you can use insecticides or you can also use sprays. Okay, and then you can follow the same method that you have used filariasis, that is gambusia fish can be used. Gambusia fish is most of the time used to control the mosquitoes. Then other than that, it is always essential to provide good nursing care for the person with the malaria. For that, you have to monitor the vital signs. So frequently monitoring the vital signs is very essential, especially temperature, pulse and respiration has to be monitored. And then you can see that if a person is unconscious, in that case, airway has to be maintained, maintain a clear airway. You can give lateral or semi-prone position to avoid aspiration of fluid, and then NG tube can be inserted. You have to maintain intake output chart. Then along with maintaining intake output chart, it is very essential that you have to always provide adequate fluids for the patient. If the patient is not taking anything orally, then you can start with IV fluids. Then next is noting for the presence or appearance of hemoglobinuria. Hemoglobinuria means, already I have told that, that is presence of excess free hemoglobin in the urea, in the urine. Okay, so here the urine may be dark in color. Along with that, it is also essential to monitor the level of consciousness and monitor the behavior of the patient. And then if patient is having excess of body temperature, you can also perform tepid sponging, or you can give cold compress to the patient. So that is particularly done for the management of malaria.